This week, we are celebrating the work of nurse practitioners, valuable folks who help millions of us with our health care and in underserved, especially in rural communities. Joining us here right now, the president of the American Association of Nurse Practitioners, Stephen Ferraro. Stephen, great to have you on. I know you're in San Fran, so it's an early start for you. Great to have you on. How you doing?
I'm well, thank you. Good morning.
Good morning. All right, so nurse practitioners, how do they help kind of fill the gaps in healthcare? Because I remember when I was living in New York City, I could almost never get in to see my doctor. They're so busy, but thank God for the nurse practitioners who would squeeze you in. If you just need to get a prescription for something, it was fantastic.
Absolutely, and nurse practitioners are providing essential access to healthcare for millions of Americans. And we know that in Ohio, there are 17,000 nurse practitioners, and nurse practitioners can be found in all healthcare settings, from hospitals to clinics to school health to mental health. Nurse practitioners are providing essential access to healthcare and focusing on preventative health as well.
Hey, Stephen, I know we have LPNs, we have RNs. What separates the NP, the nurse practitioner, from other nurses?
Nurse practitioners are registered nurses first with experience and return to school, usually at the master's and doctoral levels, and have the ability to get additional education and training. This allows nurse practitioners, once they're licensed, to be able to prescribe medication, and that's the biggest differentiator between an RN and a nurse practitioner. Nurse practitioners can prescribe medications.
I gotcha. Didn't know that. My mom's a nurse, and a couple of my nieces are as well. We love our nurses in our family. You know, in general, nurses are facing a big shortage nationwide. How are you and other leaders working to build this profession up? Because we certainly saw that during the pandemic, a real need for more nurses and nurse practitioners.
That's right. We saw post-COVID a lot of people leave the profession. The good news is that the U.S. News World Report has said that nurse practitioners are the #1 in-demand job, and we're just wanting to make sure that there's enough faculty to train and educate nurse practitioners of tomorrow. So we're making sure that our federal governments can allocate money so that we can make sure that the training for nurse practitioners is there, so that nurse practitioners can provide that essential access to care.
Hey, Stephen, we know nurse practitioners, they do all right. Like, the money is good. Where can folks go with your organization to get some more information? Maybe they're considering that, changing to that profession.
Yeah, people can visit wechoosenps.org. This website will not only give you information about nurse practitioners, but we'll also have some patient information about how to treat common ailments and how to have the best outcomes for your health care.
Awesome. Stephen Ferraro, thank you for joining us here this morning. Some good information and hopefully